Hi, my name is Angelle Buquet, and for this project, the topic I chose was to discuss the misdiagnosing of mental illnesses and certain ways that we can prevent the misdiagnosing. So, as we know, people are constantly getting misdiagnosed with certain illnesses, whether it be a physical illness or a mental illness. We are seeing these common mistakes happening all over the world, different countries, and also happening in different settings, different clinical settings. So, a false positive is considered an ethical and clinical issue occurring when symptoms are mislabeled without meeting the proper dysfunction requirements. So, false positives and misdiagnosing go hand in hand. They're basically the same thing. There can be many reasons behind these false positives. In some instances, the misdiagnosing can be considered accidental, and in other cases, they can be labeled as intentional. And this can both happen from either the doctor or the physician and the patient. So, for this project, I chose to watch Brain on Fire and One Flew Over the Cuckoo's Nest. So, after watching both of these films, I was able to see an instant of both the accidental and the intentional misdiagnosing situations. In the movie Brain on Fire, the main character, Susanna, she is a 21-year-old working at the New York Post, and she begins facing these symptoms such as memory loss, confusion, and as well as seizures. And over time, her symptoms just began progressively getting worse. So she began to go see doctors. She set up many appointments trying to figure out what the problem was and just to simply find answers. However, the doctors kept misdiagnosing her with different mental illnesses. They were telling her she had bipolarism, she had schizophrenia, she was simply just drinking too much, and also that it was just pure stress from her job. And so, due to all of these false positives that they were giving her, her health began to deteriorate very quickly. And so, for my next movie, One Flew Over the Cuckoo's Nest, the main character is a guy named McMurphy, and he entered the psychiatric hospital in an attempt to avoid serving time due to a charge of rape. So, while he was in this hospital, he had to mingle with all of the mentally ill patients, and he was very harsh to them, and he was just trying to fake the mental illnesses in order to receive benefits such as less work or better food and better living environments. And this movie really showed me how some people abuse the label of a mental illness in order to receive a benefit. So, to get started, the intentional misdiagnosing. Like I said earlier, there are many possible reasons for misdiagnosing. However, two important ones that I want to touch on are the intentional reasons about insurance reimbursements from different insurance companies and to avoid certain life situations. So, to start off with the insurance reimbursements, counselors or medical professionals have often been enticed to break the codes of ethics by misdiagnosing mental illnesses to patients in order to receive reimbursements from the insurance reimbursements. For example, if a patient was not able to pay out of pocket for certain treatments, the medical professionals would submit inaccurate diagnoses in order to receive the reimbursements from the insurance companies. So overall, this is just unethical and can eventually affect the patient in the long run. And so for the second topic for misdiagnosing, just simply trying to get out of certain life situations, many people fake these illnesses to avoid life situations, like I said, such as jail, work, or even trial. So the medical term used for this is malingering. Malingering is the forgery or exaggeration of an illness to receive benefits. And like I said, we saw this in the movie One Flew Over the Cuckoo's Nest with McMurphy just trying to get out of his sentence because of the rape. So people may use malingering for multiple reasons, such as to avoid responsibilities, to seek out drugs, to avoid military services, to leave from school, or as well as just to get paid leave from a job. Malingering can occur with both mental and physical illnesses. These reasonings help explain how important it is when diagnosing patients with mental illnesses. This just stresses the importance of taking the time to dig a little deeper into each patient's case. I believe this, because everyone's case is different and it may be harder or more difficult to detect if someone is faking their illness or not. And so now, ways to lessen the chances of misdiagnosis. So in order to decrease the mishaps with misdiagnosing, changes need to be made. Although it may be deceiving when trying to detect if someone is faking a mental illness or not, there are tests to help identify the wrongdoers. It is considered easier for a faker to avoid detection of malingering when confronted with only a singular test. So this just shows the importance of a battery of tests. So a battery of tests is just a compilation of psychological tests used all together to help find one result. So in a study by David Shretlin and Hal Arkowitz, inmates were asked to answer certain questions as though they were insane or mentally retarded, and these results were then compared with those who were actually mentally ill. The inmates were compensated for simply participating in the study, but if they were able to go undetected or act as though they were truly mentally ill, they were compensated more than just those who were detected. So this study proved that a test battery is more efficient when trying to detect those fakers rather than just a singular test. Another way to help lessen the number of mistakes is by having a psychiatric liaison team on site at medical facilities. There was a qualitative study held interviewing 18 doctors, 21 nurses, who all worked at 4 different hospitals about how mental illnesses diagnosing have affected the diagnosis of physical problems. The study revealed that the misdiagnosing could have been due to patients' challenging behavior or just due to poor communication. These psychiatric teams, or teams specializing in reducing the risk of misdiagnoses, were used within the study, trying to see whether they were beneficial when lowering these risks. The results concluded that having these teams on site do help lower the possibility for misdiagnosis of both mental and physical illnesses. So overall, the misdiagnosing of mental illness is a very common problem that we see all over in today's health system. The misdiagnosing can occur accidentally by confusion or by miscommunication, even intentionally for insurance reimbursement or even to avoid just certain life situations. Although the medical professionals usually receive the blame for these false positives, some of the time it can be the patients that are to blame when they are at fault. And this can be due to the malingering. The physicians will be required to look a little deeper when diagnosing these patients. Improving physician-patient communication will be very beneficial when helping to stop the misdiagnosing. And also, I believe adding steps in the process of diagnosing would help to detect the malingering. So as the health system works to reduce the numbers of the misdiagnoses related to mental health, it will be crucial to continue with what they've seen has worked in the past. So what has been proven to work, like these specialized teams and the battery of tests. I believe attempting to enter a psychiatric hospital the people attempting to enter should be required to answer a test battery in order to rule out the fakers. This may help limit the amount of people abusing the mental health care system. And moving forward, it will be very important that physicians take extra measures to ensure the proper diagnosing of mental illnesses.